present to us Laura Connors, who's my resident this rotation in child and adolescent mental health track. She's doing a rotation in eating disorders with me. And she's completing her PhD in clinical developmental psychology at York University in Toronto. Laura has experience working in inpatient, day treatment, and outpatient eating disorder programs in Ontario and Nova Scotia, as well as extensive training in working with emotions. So I would like you to give a welcome to Laura Connors.
Thank you, Dr. Gisela, for that introduction. So again, welcome to everyone who's here in person and also those who are joining us remotely on this nice sunny evening. So tonight, I'd like to talk about the weight of feeling, how parents can help adolescents with eating disorders and emotion expression. And so within the hour, I'd like to sort of give you a bit of a sense of what an eating disorder is, how to recognize one and get help. I do recognize that there's a lot more than that I could talk about in terms of fitting things into an hour. But I'd like to sort of also offer a bit of a new lens that maybe you haven't looked through before when it comes to eating disorders, and that's the link between eating disorders and emotion. So I'd also like to discuss how emotions are linked to symptoms of eating disorders, and also spend some time with you learning about emotions and hopefully send you away with some tips around better understanding, communicating and emotions with the young person in your life. And so just as a note, sort of the scope of this talk, we'll just focus on children and adolescent sort of age group with eating disorders, but also certainly recognizing that eating disorders do affect adults as well. And we will have some time at the end for questions, so please do save your questions for the end, and I'm happy to have some discussion at that point. Okay, so first of all, why I called my talk The Weight of Feeling. We sort of know that emotions can be linked to eating, and certainly lots of people might be familiar with the term of an emotional eater. And for someone with an eating disorder, we know from clinical experience and also from research experience right away that this illness isn't as simple as just being about food. And many girls often talk about feeling fat, and we know that fat is actually not an emotion, but they might describe feeling fat when really they're feeling sad or lonely or angry or ashamed or a failure, so other kinds of really difficult or heavy emotions. So what's really going on here? It seems that somehow in emotions in particular, heavy ones or difficult or uncomfortable ones can clearly play a huge part in how we see ourselves, how we see our bodies, and then what we do around food and around eating. Okay. So certainly, we sort of know that it's pretty common for young people to have issues or concerns around their body and around food and around eating during adolescence. There's a number of different studies that have sort of looked at this in junior high and high school populations. And for instance, some studies have found that about a third of girls and a quarter of boys report being teased about their body or their weight by peers, and a third of girls and about 15% of boys report teasing by family members about their weight. We also know from surveys, adolescents in high school who are within normal weight range, about a fifth of those report that they feel that they're overweight or too fat. And from other studies that have looked at young girls have reported that they're more afraid of becoming fat than they are of cancer, of nuclear war, or of losing one of their parents. So we certainly know that these kind of issues exist. And for Canadian teens between the ages of 11 to 15, about a third to half of those individuals do report and say that they'll need to lose weight. So it is pretty common in our society, and we certainly know that these kind of concerns exist along a continuum from healthy eating to having some concerns about eating and body image and disordered eating to having an eating disorder. And certainly something becomes a disorder when it starts to impact your health and where symptoms actually take precedence over other parts of life. Okay, so for someone with an eating disorder, they're absolutely terrified of gaining weight, and their mind can become completely preoccupied with thinking about food and weight and exercise, and so much so that their mind is completely consumed and in a constant turmoil all of the time about these issues. So how does someone deal with this? Well, often young people will use unhealthy weight control methods, such as restricting, so really limiting their food intake, to using excessive exercise, that's to a point that it's unhealthy, and other methods to get rid of calories and food consumed. However, food and eating, we know, is such a regular part and an important part of daily life. One can start to begin to actually rearrange their life around these symptoms in order to avoid or control those situations, which often can result in withdrawal from family, from friends, from relationships, and just really from life in general. We're often sort of used to pictures in the media kind of depicting someone who has an eating disorder, such as anorexia, like the person the second from the left. However, especially in adolescence, all these people may be quite ill. And often it's the case that children and adolescents with disordered eating may not actually look sick or appear to be underweight. But having sort of a minimal loss in weight, but combined with sort of growth and the changes that are associated with puberty, that sort of combination of the growth and also food restriction is very dangerous, especially in teen girls, because we know that that's the time period when sort of everything that you're taking in is the foundation for laying down kind of bone development, and that's when calcium is very important, and sort of what you develop during those years and just into the early 20s is sort of what you have for life. So it's really an important time for young people to be nourished properly. So it's also important to keep in mind that weight or appearance isn't necessarily the predominant marker of an eating disorder. Often those sort of at or even above a natural weight range may not be getting proper nutrition and may be using unhealthy weight control practices. So it's important just to note that malnutrition can occur at any weight. Okay. One of the things that can be really tricky and challenging, especially for carers, is that individuals with an eating disorder often don't recognize that they're ill. And that's a symptom of the illness. And what happens that's really tricky is that it's precisely the traits that one might have that help maintain an eating disorder, such as being a bit more perfectionistic, being a bit more anxious, being a bit more obsessive, are also the ones that support high achievement in other areas like school and sports. And that's precisely the thing that can actually kind of work to disguise the illness, because people may think, well, if they're doing so well in all these other areas of their life, how can they be ill? And that's why the role of parents in supporting young people with eating disorders is absolutely essential. And one of the biggest sort of struggles that catches parents and even clinicians is that reasoning or thinking about this illness in a logical way or trying to use logic won't work. If a brain is malnourished, it's in starvation mode and it isn't sort of functioning the same way or able to make decisions in a healthy way. And another symptom of an eating disorder is a distorted body image. So the idea that looking at yourself in the mirror, you may not see what's actually reality. And it's hard to wrap your mind around someone who has a distorted body image, but one way to try to understand that might be to think about that we look at ourselves through our own sort of emotional filter. And if you're not feeling good about yourself, if you're feeling weighted down by the day, you're probably not going to see something good in the mirror either. So for instance, if you imagine you came from a really rough day at work and you didn't meet expectations for your boss, for instance, and you look in the mirror and that might influence how you see yourself, and you might sort of feel weight of that kind of failure or disappointment of the day. And we also know that about 60 to 70% of individuals with eating disorders are also diagnosed with anxiety or depression. So certainly that supports the link between emotions and how we might also see our bodies.
Neonatal team to Site 25, NICU stat. Neonatal team to Site 25, NICU stat. Neonatal team to Site 25, and ICU staff.
Okay, so how common just are eating disorders? Well, we know that across the sort of a lifetime, about 3% of women and 1% of men will be affected by an eating disorder. And if we think about in adolescence, we see about between 1 and 5% of adolescents who are diagnosed with an eating disorder. So if you think of your average kind of sized high school, about 2 to 3 per every 100 of young people will have these kind of concerns, and that's outside of just kind of maybe even typical kind of concerns about body or weight or something like that. So another thing to think about are sort of symptoms, and some of the symptoms I've listed here kind of cut across some of the different diagnoses we would have in terms of an eating disorder. So first of all is restricting, which is really severely limiting kind of your food intake. Another is binging, which is often as a result of really limiting how much food you're taking in, sort of going and eating above and beyond what might be typically expected to eat at one time. And then purging, which is a way to sort of get rid of kind of calories consumed, and that can be done through a number of different methods. So thinking about sort of different diagnoses, we have 3. So the first is anorexia, which is characterized by a refusal to maintain a body weight at about the 85% of what would be ideal for that person, based on their age and their height.
Sorry to interrupt. Can one of the offsite mic is open? I can hear a bunch of clunking around. Would you please make sure your mics are all on mute, please?
And it's also characterized by an intense fear of gaining weight and that distorted body view that I kind of showed a slide ago. Bulimia nervosa is characterized by binge eating, so eating kind of more above and beyond what would be expected, feelings of loss of control while that's happening, and also engaging in compensatory behaviors, so exercise or purging as a way to sort of get rid of those extra calories. Okay. And then we also have another category, which is an eating disorder not otherwise specified, which is actually the most highly diagnosed type of eating disorder. And what that is someone may sort of have many of the features of anorexia or bulimia, but don't quite meet criteria of one of those. However, we do know from research that the risks and the implications of being diagnosed with EDNOS are just as severe as the other categories as well. So it's by far, certainly not a means to say that this is less severe. It's certainly a concern as well. Okay, so what do we know about eating disorders? They're the third most common chronic condition in adolescent females after asthma and obesity. But we also know that about only 1 in 10 individuals will seek help on their own, and that's why we know that parents or caregivers are vital in recovery and getting support for their young person. And it takes on average an individual between 7 to 13 years to ask for help by themselves. And certainly there can be lots of damage during that time. And we do know that chances for recovery are certainly increased with earlier identification and treatment. Okay, so first of all, who do eating disorders impact? Well, we know eating disorders happen to families and impact every single member of a family. And often, I speak with parents and they'll talk about, they'll have a lot of questions around, well, why didn't I see this? Why didn't I notice something? Why didn't I do something? And we really sort of think about those as sort of questions of the past and just really focus on sort of moving forward, because we know that, there's nothing that parents do to cause an eating disorder. And certainly we just sort of focus on going forward and, helping parents with the task of supporting their young person with this illness. And, similarly, we also know that individuals do not choose to have an eating disorder. And many young people I've talked to, while they're very ill, will often say that, I hate this is awful, I wouldn't wish this upon my worst enemy, but really just feel powerless to talk back or speak back against the eating disorder. In terms of who else they impact, so we do know that they are more common in females, but we are seeing increasing numbers of males who are diagnosed. So about 1 in 10 individuals who are diagnosed are males. And I did put some handouts at the back, and one of which is the Living Healthy in Atlantic Canada magazine, which profiles our eating disorder clinic here, and that does actually discuss the profile of a male who was diagnosed with an eating disorder. And in terms of age, we do see the eating disorders start in adolescence and often continue through young adulthood, with the onset of about the mid-teen years, about 14 to 18 years of age. But certainly pictures like this are becoming more common, and we do see kind of the onset becoming early, younger and younger. We do know that anorexia, the onset tends to be earlier teens, about 13, 14, but certainly these issues can start coming about in older children, so between the ages of 8 to 11. We see more binging and purging and bulimia that comes along with more extreme dieting in the later teen years. But those individuals often have a long history of preoccupation with weight as well. And certainly the youngest person that we've seen in our clinic here was age 9. So certainly we do see older children as well. So just along those lines, thinking about kind of children and sort of what parents may be able to think about, is one sort of thing to keep in mind is something parents can do is really try to promote a healthy body image in a young person. So really focusing on ideas of being healthy and strong versus being thin, just having discussions around beauty, about being, more than kind of outward appearance, and talking about internal attributes as well. And also just using any opportunities that come up to have those kind of discussions. We also know that emotions and eating disorders are linked, so tuning into a child's emotions and helping them learn how to regulate and cope with difficult emotions is also something that's been helpful. Also role modeling healthy eating, so thinking about eating, perhaps having a meal together at the end of the day, and thinking about this as a time to share the day and to be a positive experience, and avoiding sort of commenting on body or weight or talking about diets, and just sort of promoting eating well-balanced meals and just having variety, treats as well, and just eating lots of different foods. The thing that happens with eating disorders is choices become more and more limited and restricted. So just promoting that variety, and also thinking a bit about your own kind of role modeling as well, because certainly young people, even if we don't necessarily think they are, they're sort of picking up on and watching sort of all the time, and just reflecting a bit about your personal views about your body, about dieting and about eating. And often adolescence is a critical time because parents may be getting into sort of middle age and also maybe doing some of their own dieting, and just kind of recognizing with your young person that maybe your needs might be less, could very well be less than maybe what their needs are. So just being mindful of that. And also teaching your young person to be a critical consumer of social media. It's becoming sort of more and more the norm that sort of the models and the photos and images that young people are exposed to constantly are becoming less and less even real, in terms of with the advent of computer images and photoshopping, and just sort of teaching them to sort of consume those things with that in mind. Okay, so why do eating disorders happen? Well, first of all, there's no one known cause or gene, and we really take the approach that it doesn't really matter. No one's to blame, just what's important is to move forward in terms of treatment. There are a number of biological and environmental factors that we know are associated with an increased risk of an eating disorder. So certainly if there's a history of anxiety or an eating disorder in one's family. Also, certainly females are at higher risk, and the adolescent sort of period is sort of the time to be mindful of this. Also, certainly social or cultural factors and sort of the images that young people are exposed to can play a role as well. And certainly exposure to certain stressors that might occur, or having a history of weight-related teasing. These are all some of the things that can kind of come together. And also temperament. So for some young people, a desire to do really well, to want to succeed, to maybe be a bit more perfectionistic, driven, anxious, and be more sensitive to emotion are some traits. However, those are also some of the same traits that we'd really want in our children, and some of the traits that would really help someone to succeed and do well. So they're not a bad thing, but they're also the things that can work to support an eating disorder as well. Okay, so how does restricting or dieting get to something that's out of control? Often an episode of dieting will start quite innocently and can happen in response to weight-related teasing, or perhaps friends or parents start dieting, a transition, maybe a transition to high school, or dieting to perform better at a certain sport, or with beginning of dating, things like that. And it can sort of start with maybe just cutting out snacks or desserts, but then sort of move to cutting out proteins, fats, sugars, and result in really detailed calorie counting and exact measuring of food. And eating can become really secretive as well. And so what happens is that eating becomes associated with feelings of guilt and anxiety and anger, whereas not eating becomes associated with feelings of accomplishment or power or strength. So it sort of gets reinforced. And a goal sort of goes from losing a particular amount of weight or to being at a certain weight to it shifts to just weight loss, period. And emotionally, for many individuals, not eating can become linked to actually not feeling, which leads to someone feeling numb or shut down emotionally as well. And this cascade can happen gradually over a year or more, or can happen quite quickly within a few months. Okay, so what sort of happens in terms of this binge purge cycle and what we would think of as bulimia? And this can often start with really severe dieting, and by severe I mean it can be as extreme as eating essentially nothing all day or very, very little. And what happens with that is that this sort of extreme deprivation leads to a really strong urge to eat. And then what happens is someone, isn't able to sustain that. So they eventually sort of are able to have to eat and then end up binging on food and sort of really feeling out of control and eating quite a lot. And binging can also become a way to sort of cope with emotion as well. Feeling lonely or feeling anxious, it can serve that purpose. And then what happens after a binge is that a person might feel incredibly guilty for having failed at what they were trying to do. Fear about gaining weight, really anxious, and ashamed for not being able to sort of keep up that plan or that idea of how they were going to diet. And then so they need to sort of do something with those feelings and get rid of those feelings. And often what can happen is purging, so either self-induced vomiting or purging by engaging in excessive exercise or using laxatives or diuretics or anything to sort of get rid of those calories that were consumed. And what can also happen is someone might become quite down or depressed and start to withdraw. And in order to sort of be able to engage in those behaviors, what can happen is their life might start to get sort of organized around symptoms. And then there's sort of a commitment to kind of start over and try that again, and sort of the cycle kind of starts again. And ultimately, it's a cycle that isn't going to work in terms of that severe dieting. So it really becomes entrenched, that pattern. And self-worth becomes dependent on body weight and image, and really the emotion here is just really feelings of out of control and not being able to control anything. Okay, so why be concerned? So these are, on the left, a picture of identical twins. And the one on the left that you see when they're older has an eating disorder. And so you can sort of see the difference in terms of height, in terms of thinking about those critical years of growth spurts, and things like that if your body's not getting nourished appropriately. And certainly there's a number of serious medical complications that really involve sort of every organ system in the body. So I won't go through them in extensive detail, but again, I've mentioned a lot about, for females especially, that sort of laying down the foundation for bones is really critical during the teen years. And also what sort of happens when someone's malnourished is their body and their brain starts to kind of pull back from any kind of non-essential critical functions, right? So it's really protecting kind of the cardiac system and the brain, right? And everything else is kind of secondary. So those are just some of the things that you might see in a young person, and also thinking about if there's excessive purging happening, there's often kind of dental damage from that, and certainly some cardiac issues around if there's malnourishment, but also if there's a lot of purging in terms of that really disrupts the electrolyte balance in the heart, and what sort of needs to happen there, and then lots of other implications as well from those. So certainly, as I've mentioned, the early kind of recognition and diagnosis is really important. Okay, so some things, certainly there's lots of physical and emotional changes, but some things that you might also see is a change in food or eating behaviors. So really thinking about a change in food preferences, suddenly wanting to eat healthy, having lists of good foods and bad foods, no longer being able to eat maybe a food that they loved before and were able to enjoy and not want to have that, and becoming really rigid in food choices, not wanting to eat with the family at the dinner table, and also deceptive behaviors about food, so hiding food, eating secretly, secretly throwing food out, those kinds of things. So changes in weight can occur as well. Also thinking about kind of a need to visit the washroom right after eating, and having that focus on weight and shape, and also kind of withdrawing from friends and family and relationships and social activities. Okay, so the good news part is that there is help and there is a treatment, and very very researched treatment as well. So what that is, it's called family-based therapy. Is sort of the approach that we take to treating young people with eating disorders, and it's a 3-phase treatment. And the first phase is where we sort of ask parents to take leadership on eating and on activity until things can get back on track for the young person with the support of a therapist. And in the second phase, sort of control of eating and activity is returned to the young person, and then in the last phase, sort of normal developmental or family issues are addressed. So a bit more about FBT. A key thing to understand about eating disorders is the eating disorder is making the decision. So as such, in this treatment, really the illness is externalized as being separate from the child, in that the young person is not motivated to change unless the parent sort of gets it and recognizes the illness. And really parents are seen as stronger than the eating disorder, and as such are critical in helping their child recover with the support of a therapist. And just as an example, so at our clinic here at the IWK, we have some data on this, and when adolescents come in, they're on average between about 77 to 78% of their ideal body weight for their height and age, and about 3/4 of those adolescents, even though they're that low in terms of their weight and are quite ill, basically report themselves that they're not motivated to change, maybe that they don't see that there's a problem. So certainly that's how we know getting parents involved and caregivers is critical. And as I mentioned, we take a no blame, sort of no cause approach, and parents or caregivers with support are sort of take over nourishment and meals, and supporting their adolescent with a compassionate but firm approach. And just to illustrate this concept, in thinking about how a child might be clouded by an eating disorder, and that this isn't a rational or logical thing, and I've often heard parents remark that it's as if since the eating disorder has happened, their child is a different person, in that maybe they were a child who was very honest, never deceitful, never one to lie or irritable, and that they've just really changed with the illness, and that just really supports that the eating disorder is in charge. And is sort of calling the shots. And if you can imagine the weight of an eating disorder on a young person's shoulders, that's the struggle in terms of emotions. And so parents take control because the eating disorder will make the choice for the child and is stronger. And sometimes parents are surprised by that because they might be used to giving their choices to their child, especially in adolescence. However, if we give a choice to someone that is so clouded, the eating disorder will make the choice. And often, if a parent were to ask, do you want to go for a run? The child has to say yes, because they're sort of not making that decision. And this can be confusing for parents, but if given that choice, then the eating disorder will make it. Another sort of key thing to think about is the importance of parents and families, and I've sort of mentioned this a bit already, but I really just wanted to drive that point home in terms of when parents sort of take charge, it really sort of increases a child's sense of safety and security and the confidence to face the eating disorder. And one young person has referred to it as like a tug of war. So if it's just her on one end against the eating disorder, really she has no chance. But the more family members that are sort of on her side and pulling against that, now it's the eating disorder that doesn't stand a chance. Okay, so another important thing to keep in mind is that we really think of food as medicine. So, if a child was diagnosed with diabetes, we know that the treatment is insulin and they need to take that insulin, and that's a non-negotiable. So in treatment for eating disorders, parents take charge of that feeding, of interrupting symptoms, of supporting a young person to stop binging and purging, and also make decisions around activity. And that can be tricky for parents to understand, especially if you think about, a 15 or 16-year-old and telling them, I'm going to decide when and what and how much they eat. That can be really hard. But it's important to think of, when it comes to making other decisions in adolescence, like choosing a course or dating, they may be at a 16-year-old level, but when it comes to sort of food and making those kinds of decisions around activity, they're not at a 16-year-old level. Okay. So meals can be a really stressful time for caregivers of someone with an eating disorder, and it's really important to have a lot of structure and support during a meal. So we often discuss what we call the 4 C's of meal support. So that's being calm, because if you're calm, then they'll pick up on that. And also being confident, so if they feel that you know what you're doing, that you believe in them, that they'll get better, they'll trust you as well. Being consistent, so not having any negotiation once it's been sort of decided what the meal is, and being compassionate and understanding that they're doing something that's really, really difficult for them. So certainly having that stance of being firm but also compassionate, it's a tough balance to strike, but it is possible. Okay. So the first thing to do if you have concerns is, talk to the young person, let them know what you've noticed and see how they react. And, this certainly gives them an opportunity to discuss things, and it also lets them know that you're okay, you're comfortable with hearing what's going on and open to hearing that. The next thing to do would be to make an appointment with your family physician, who will then look at their vitals, look at their height, their weight, their blood pressures, things like that, and together with him or her making a decision around a referral to mental health. But at this point, I'd just like to shift gears a bit and move to sort of the second half of my presentation, which is the link between emotions and eating disorders. Okay. So we know that eating disorders and emotions are closely linked, and symptoms are often used as a means to numb or soothe or block or avoid or push down or get rid of difficult or painful emotions. But the problem with this is that avoiding emotions or avoiding something that's difficult, if we do that, we never learn to kind of understand and manage and regulate, which leads us to kind of the perfect storm or setup for the development and maintenance of an eating disorder. And thinking about, learning to identify and manage emotions, it's a skill that's learned, and it's not so much unlike, tying your shoes or a course in school or learning a new sport. However, we have lots of different messages in our society, or maybe from our own upbringing, about emotions and about how they should be dealt with and whether they should be expressed or not. So I'd sort of throw the question out there to think a bit about, were your parents sort of appropriately attuned and responsive to the full spectrum of your emotions growing up? And what about their parents before them, sort of back in that generation? And think about, are you comfortable with all emotions and expressions of emotion? And do you even know anyone who actually is? So already we're all sort of off the hook. It's not something that many people learn or are taught. And, there are those differences in messages about emotion in our culture and in our family. But we do know that eating disorders and emotions are linked, and we also know that avoidance doesn't work. And as I mentioned, we do sort of get all these different messages in our culture and society that are to the contrary. So things like stuff it down, don't feel it, it's not nice to be angry, don't cry, all those kinds of messages. But in contrast to a lot of those messages about feeling that we may see, emotions can actually be quite helpful. So they can tell us what's important to us, what we want, what we need, how to act, what to do. And emotions actually function as guides and sort of tell us the way to go. So for instance, we know that every emotion has a label, so a name, bodily felt sense, which is a feeling, a sensation in our body, so we know what we're feeling, a need, and an action tendency, so it tells us what to do. So for instance, imagine if you're at work and you smell smoke and you hear the fire alarm going off. Okay, so what do you feel? What emotion is that? You probably feel fear. Okay, what happens in your body? I don't know, it can be different for different people, but you might feel kind of like a nervousness, kind of fear in your stomach, or you might feel something in your chest. What do you need? If you feel fear, what do you need? You need safety, right? And so what do? You get out of there, right? You run. Versus if you just, heard that a friend who was really, really close to you, really dear to you, passed away. So similarly, there would be a feeling, you would have a label, you'd probably feel sadness, right? And you'd feel something in your body, and for different people it's different. So you might feel like a heaviness, or you might feel that feeling in your chest of sadness. What do you need when you feel sad? Comfort, right? And so, and what's sort of the thing that you do when we feel sad? Often we kind of withdraw and want space or time to ourselves, right? So really, sort of knowing this information can really sort of help us in knowing what to do. So knowing what that need is can be helpful sort of for ourselves, but also in relationships with other people, and knowing how to respond to other people. So for instance, if you can imagine the last time that you felt really angry and upset, and you maybe went home and told someone about that, and you were saying, I can't believe this happened, I'm so frustrated, and you were looking really angry, and you were really upset, and you're sort of venting and letting it all out, and then maybe that person gives you a hug. Whoa, right? Like you can sort of feel that this is wrong, this is not what I need, right? I don't need a hug, I need to figure this out, I need to set some boundaries, I need some control, right? I don't need comfort right now. Versus, if you were feeling sad and, you were really down and feeling really bad, and then, you're telling someone about this and your voice is really quiet and the person is like, okay, we're going to fix this, we're going to do this, we're going to go here and we're going to put this in place. No, right? That's not what you need. I just needed a hug, right? So it just sort of gives us an idea when we start thinking about emotions in this way, and it can also help us out in knowing what to do, how to respond to someone else. Okay, so what can happen for someone with an eating disorder is that, emotions are unpleasant. We can really have a hard time identifying them or managing them to the point where they become just overwhelming. And so, what do people want to do when something's overwhelming, right? You want to get out of there, avoid that, right? And lead someone to feel out of touch or out of control. And often young people with eating disorders say that they don't know what they're feeling. It just feels like a big jumble. And they do know that they feel out of control. And it just feels like things are spinning or churning. So really, emotions can just start to feel like this big mess of I don't know what, sort of all tangled together. And it's this big jumble of ugh. But one thing that parents can do to help is to think about emotion coaching. And this is really helping a young person express and figure out what their emotions are and what they need in response. So thinking about helping them sort of attend to emotions and identify emotions and having their emotions validated. And so it can really shift from feeling like that big ball of ugh to feeling like sort of, okay, the threads are sort of laid out and they make sense, and I have a label for what's going on. And just this process alone can make things feel a lot less overwhelming and more manageable. And through that, they can sort of learn to trust their emotions and see emotions as safe. And that can often lead to letting go of symptoms and letting go of symptoms as a way to sort of cope with difficult emotions. So one place to start is for parents to sort of learn a vocabulary of emotions as a way to help young people start to understand. And if you talk to the teen in your life or young person, you might find out that they only think sort of in terms of a couple of emotions. So maybe angry, sad, and fat. Or that all emotions feel the same. It just feels uncomfortable or gross. And sort of starting to help them sort that out and give labels or names to what's going on. So one way to sort of keep this in mind is to think about love. So listen, understand, and validate or acknowledge. And I left some cards at the back with that sort of acronym on there just to keep in mind. So first of all, how do parents even help adolescents bring out emotions? Because before you can listen, you've sort of got to have something to listen to. So even getting them to talk in the first place and open up can take a lot of trust and can take a lot of time and patience. But, I would say hang in there and think about just being curious, listening without judgment, and just waiting, because it can be a really slow process for someone that's feeling that big ball of ugh to even just figure out how to find the words to kind of express themselves. And, they may not even know what's going on, and likely they're just feeling overwhelmed. And if we just sort of listen with our ears, we're actually missing quite a lot. Certainly tone of voice and facial cues, body language can all give you hints about what's going on if they're not sure and you're not sure either, to help them figure that out. And we do know that most of communication is not what's actually said or is not the words, right? A lot of it is those other pieces in body language. And also in families that tend to be more open in expressing emotions, sometimes what can happen is there can be a lot of yelling and someone might feel shut down. So in order for youth to feel comfortable and confident in expressing their voice, they need to know that they're not going to get yelled at, which is especially important for young people who tend to be a bit more sensitive, which we know young people with eating disorders tend to be. And there's just this process alone can be really soothing and comforting and regulating in itself. With the understanding, the goal is to really help a young person experience emotions in a healthy way. And really what you're trying to do here is to put yourself in your child's shoes and just be curious, just explore what's going on for them. And if you can find a way to understand, and sort of I'd throw this out as a challenge next time when you're interacting with someone, to really try to understand, like, could what they're saying make sense to me? Maybe you don't agree, but could it make sense? And if you can find that, then tell them that. Say, I get that, or yeah, that does make sense that you might feel that way. If you can't, then I would say don't say that, because certainly if it's not genuine, then I'm sure we've all been in that situation before where if you don't really mean it, it's gonna sort of fall flat. And then just accept or allow any emotions, even if they're different than your experience or what you might feel, if they're hard to understand, or else if it's hard to hear, right? If it's hard to stomach. Because we know that sons and daughters will only tell a parent what they think that you can handle, right? So if they think that you can't handle it, they may not share. So saying, I really want to hear your voice, and yes, I may cry or I may be hurt, but that doesn't mean I can't handle it. Okay? So if we feel something, it's real, it's our experience. And to validate someone isn't acknowledging the way it is, it's acknowledging that this is real for them, that this is their experience, that this is tough. And until we're acknowledged, we kind of get stuck. So we have two choices. We can either keep trying to explain and convince someone, or we're going to shut down and say that there's no point. And you can't move on from that. So you're kind of stuck if one of those things happen. But just keeping in mind that acknowledging is not agreeing. So for instance, if a young person says, I'm so fat, certainly you don't want to agree with that. But you do want to validate that this is awful for them. They feel horrible, and that's really hard. And so just keeping in mind that it doesn't mean you agree, but for certain you're getting that that's their experience. And so just thinking about what's the most natural thing to do when someone that we care about is in pain or is struggling, well, we're desperate to help them and make them feel better, right? But sometimes our efforts to try to protect someone can lead us to go about maybe fixing something before we're given permission to do that. Or, they may sense that they can do it on their own, but, they're afraid that you might jump in and fix it, so they may not talk about that. It may be the case that all they want is just for you to know what's going on. So one thing to think about is to try to hold off on kind of fixing it or going for the bright side and just focusing on empathy and exploring and understanding and just being curious. Because if fixing it is not what's needed with that emotion, then you sort of run the risk of them becoming frustrated or shutting down, and sort of miss out on that opportunity for them to kind of develop trust in themselves, that maybe this is something that they can actually handle on their own. Okay, so that all sounds terrifically easy, right? And something that we're all going to go home and do, and it's going to be great. But I do have to say, I really feel that I don't think parents get the credit that they deserve. And I've worked with a number of parents who really rise to the challenge of being able to do this, and who've gone from maybe being really uncomfortable or even terrified about opening up emotions with their young person. And actually, I have to give them lots of credit, because a lot of parents really have the ability to do this, and maybe they don't realize that. So certainly that's something that I wanted to mention as well. So certainly I've taken lots of courses in my training and graduate work, but never have I taken any courses in drama or theater arts. But we're going to try to demonstrate a couple of these ideas together with Dr. Gisela. So we have a situation where a young girl has come home with a mark on an assignment that she got 80% on, and she's quite upset by that. And I'd just like you to kind of think about or watch for some of the things that I've been talking about. So certainly the words, what she's saying versus what she's communicating with her body language and what she's actually maybe feeling. Think about fixing it, and maybe try to put yourself in the daughter's shoes or the mom's shoes in terms of what it might be like for them in that situation. And just sort of tuning into all those pieces. And certainly we'll have sort of a couple ways it could go, and then we won't have time to sort of connect with you in between, but sort of at the end when we have questions, please feel free to bring up any questions or comments that you had.
Mark, can we set ourselves up in the center there? Just
You can, if you're nice and loud, anyway.
nice and loud.
Yeah.
Speak loudly. Okay, we'll just take 2 chairs, I guess. Is that okay, Laura?
Yeah.
And just let me know where we should put the chairs. Is that okay?
Yeah, that's fine.
We have to speak loudly, right?
Okay.
We'll just move this for now and put this sort of,
Oh, great.
if you don't mind maybe holding that
Not
on
a
your lap for
problem.
now, that'd be great.
Just let me know whether we're loud enough.
We should be fine.
Can people hear it? Okay. So I'm the daughter?
Yes.
Mom. Oh, I can't believe it. 80%. I got 80% on this assignment. Ugh.
Honey, 80% is a good mark. You can still make IB with an 80. As long as you do okay on the next test. Maybe, actually, I remember Mark next door. He did a bunch of math competitions a while ago. Maybe we can
You
call him.
don't get it. I'm such a loser. Oh.
Honey, you're not a loser. 80's not that bad.
Just, oh, God.
I don't understand what's wrong with you. I'm sure Mike would help if we call him up.
Shut up.
Okay, I'm just trying to help. If you're going to be so ungrateful, you can just go up to your room.
Oh. Okay.
Okay, so, yeah, and we're just going to take a second here to kind of connect with each other about what that experience was like. So, for you, as the daughter, what was that like for you?
I just felt you just kept talking and I couldn't get you to stop.
Okay.
And you didn't get it. You didn't get what I was so upset about.
Okay. Yeah, and for me as the mom, I just felt really frustrated. I was trying to help her, and I just feel like I could never say the right thing to her, and I feel like she thinks that she doesn't think I care, and maybe feels like I'm just a bad mom and I can't just seem to get it right. Okay, so we're gonna do it again and see maybe how things could go a little bit differently this time. So again, just sort of thinking about these things to keep in mind.
Oh, geez, 80%. Oh.
Oh, and you sound really upset.
I am. What do you think? 80%. Oh, geez, how could I have done that? There's no excuse.
Well, what's so upsetting about that, Mark?
Well, 80%. I can't believe it. I wanted 90%. I worked. And there's just no excuse for this. I must be an idiot.
Well, you sound like you're pretty disappointed, huh?
Disappointed. Like, this is the end of the world for me. I needed to get that 90%, and I didn't. And I'm just such a loser.
Is there? You're disappointed, it sounds, but I mean, is there something else going on?
Well, are you disappointed?
I mean, there's a lot of pressure on you, along with your other classes and soccer team and your part-time job. It's tough to juggle all that, even for adults.
It is. Do you know that? Do you know how hard I try?
Yeah, I mean, it sounds like that's a lot of pressure.
It is a lot. It is a lot, and I thought I'd have more time to study for this test, and
yeah, I mean, that's a lot to have on your plate. Is there anything you need from me?
I need to know that you're not disappointed in me.
Of course I'm not disappointed, okay? Absolutely I'm not disappointed. Were you worried about that too? Yeah, okay. Well, I'm just really glad that you're able to tell me what you were thinking about. I'd much rather talk about it than have you feel all that pressure and all that, pressure and weight on you, all on your own.
Okay, thanks.
So that was just a little bit of a scenario of a couple ways things could kind of unfold.
Yeah. And the second way, I certainly did feel more listened to and kind of surprised that my mom was being so understanding.
Okay.
And how was it for you?
Yeah, I mean, I really felt like I was getting somewhere as mom, and that, I wanted really badly to sort of just say that, it was okay and she didn't need to be worried about that, but yeah, I just tried to kind of hold back a bit and try to understand kind of a bit more from her what was going on. Yeah. So, okay. Certainly things never sort of go, that way in terms of, but just to give you a bit of a snapshot. Okay, so just a few things to think about, and as I mentioned, I do have sort of some handouts at the back, so the little love card reminders and some other kind of resources as well. And just in terms of general resources, there's a lot of really great books out there for parents. In particular, the Help Your Teenager Beat an Eating Disorder is based on and written by the developers of the Family-Based Therapy. And so that's a really great book as well. And also some websites there. And the first one at the top is a website, again, for those, the developers of the Family-Based Therapy for Parents. Has a lot of really great resources on there. A few others as well. And then at the bottom, there's a really great online videos around meal support and how to do that with a young person. And it also is really helpful in terms of giving a perspective of, there's some young people interviewed on there in terms of just understanding kind of what things are like for them as well. And so that is it in terms of that part of the presentation. So I just like to open it up for questions.